We take going to the toilet normally for granted. And if there is dysfunction of that, if you're not able to hold on to your urine, or if you have difficulty emptying your bladder, it has enormous consequences, not only for you as an individual, but also for our whole society, because there are enormous costs involved with that. As a clinician, my role is to treat patients, to actually diagnose the problem and find the effective treatment for them. But clearly one of the major issues we have at present is our understanding and depth of understanding about bladder function. We also recognize that there is an important link to the bladder function relating to pharmacology, which is the chemicals which are released onto the muscle in the bladder by the nerves, which result in the normal function we take for granted. And indeed, we do use a number of drugs which act pharmacologically on the release of these neurotransmitters. And it's a greater understanding of that which we need to have for the future. So clearly, this is a very important area which has enormous social and financial consequences for the population.
The sensory nerves in the bladder have their endings within the bladder wall, and they detect the degree of stretch within the muscle. As the bladder fills, the stretch increases, and that increases the sensory signals that pass to the brain and the spinal cord. At some point, the level of activity in those sensory nerves reaches a point in which a trigger is activated that converts the bladder response from one of filling into one of contraction. And that contraction is a part of that process of passing urine. And as a biologist, the critical question that we're asking ourselves is, what determines that switch from storage mode into contractile mode? The kind of experiments that we do is to record from these sensory nerves as they generate these signals from within the bladder wall. As you can see, as the bladder fills, the frequency of action potentials in these nerves increases, and that increase in frequency is what the brain uses to interpret the need to switch from storage to contraction. So this is where modeling comes in. If we can understand the complex interplay between the muscle, the sensory nerve endings, and the cells that line the bladder, these are referred to as urothelial cells, and they respond to stretch by releasing chemicals that influence the muscle and also interact with the nerves. So we've got this interplay between various structures and elements within the bladder wall. If we can understand those, then it allows us to develop strategies for drug development, which will allow us then to target those mechanisms in order to treat bladder disorders.
The bladder is quite a complex organ, and if you think about it, it must undergo very large deformations as it fills and it empties. And how it achieves that is related to the underlying microstructure and mechanics of the tissue components. So it's very important, if we want to understand how the bladder functions, to understand this relationship between tissue microstructure and mechanical function. As we all know, as we age, our tissues change in their properties. For example, our skin becomes less elastic, and this happens to other tissues within the body, including the arteries, the heart, and also the bladder, and it can affect the mechanical function. State of the art in modelling the mechanics of soft tissues involves going from detailed imaging, which shows the underlying microstructure of the tissue, and we can create conceptual representations which show how that tissue structure and the cell structure combines together. So what that enables us to do is that we can build models which relate how that tissue structure changes as the bladder fills, as it empties. And we can also think about, well, if that tissue structure changes during disease and aging, how will that affect how the bladder fills and it empties?
I think that modelling gives you great potential, because particularly if we're using pressure flow studies, we have a lot of detailed information which is very patient specific about the function of their bladder. And if you can feed that into a modelling system which makes objective, rational decisions without the subjective bias which as individuals we bring to it, it'll allow you potentially to advance knowledge very rapidly, to find more effective treatments and to optimize the management of any individual patient.